The poor performance of 5 NHS hospitals in this area is now so serious that answers are being demanded at the top of government. Today, this man, the Health Secretary Wes Streeting, said that failure had been tolerated for too long, and he put a handful of hospital trusts on notice to urgently improve services for patients. That includes 2 run by this woman, Lynn Simpson, who is in charge of hospitals in Hull, Castle Hill, Grimsby, Scunthorpe and Goole. And today it's emerged that her former trust is also on the list of shame. Our political editor Tim Iredale has this report.
People are very poorly and they need treatment and they're not getting it.
The management needs to get on the floor and work alongside the nurses to see what they actually have to do in the time scale.
Well, it's more of an opportunity in terms of what we can turn it around to.
An intensive recovery plan. It sounds like a form of treatment that could be given to a patient, but this is the medicine the government has prescribed for some of our local hospitals. It's aimed at trusts at the bottom of the NHS league tables, where patients face the longest waits, also where there are persistent financial problems and what's described as a high leadership churn.
The 5 trusts where we've had stubborn underperformance, where I'm sending in NHS veterans with experience of turnaround to drive improvement in North Cumbria, in Hull, in northern Lincolnshire and Goole. Those trusts have been stubbornly underperforming.
This means that our main hospitals on both sides of the Humber are effectively in special measures. And local politicians are keen to find out just how long it will be before we start to see some real improvements.
I was in Grimsby Hospital visiting the renal unit only last week, and you talk to people who are very satisfied with the treatment that they're receiving. They're doing their best, but as Wes Streeting has pointed out, it's the leadership churn that is very damaging to delivering on any form of improvement plan.
Last night we heard from the acting chief executive of the trust that runs Hull Royal Infirmary and Castle Hill Hospital, ranked at the bottom of England's league table, 134 out of 134.
Is there bullying going on?
I would suspect that there may be some interpretation of bullying going on in the organisation, which I want to understand, because I've got a zero tolerance to bullying in the organisation.
It's emerged that Lynn Simpson was formerly an NHS boss in Cumbria, where serious concerns were made about bullying and discrimination 2 years ago. At the time, Ms Simpson said the claims made for sobering reading and insisted that action had been taken. North Cumbria Integrated Care is also one of the 5 trusts that today was placed in the government's special recovery programme. Tim Iredale, BBC Look North.
Well, raising concerns on this, Dame Diana Johnson, the MP for Hull North and Cottingham. She's joining us live on the programme tonight. Dame Diana, good evening to you.
Good evening.
Can I just start by, so many trust staff have written to me. I'll read you a couple. I've been bullied. I've witnessed bullying that makes people leave. And this from someone who's in a senior management position at the trust. The chief executive has marginalised staff and has no leadership. These are from staff members. Your reaction?
I'm appalled, really, to hear those comments from the staff at the local hospitals. And I've been an MP for a long time, and I know there have been allegations of bullying in the past which were well-founded. So it worries me greatly that we are now seeing that again in our local hospitals. But I am really pleased that Wes Streeting today has taken really decisive action and said that it's not going to be tolerated any longer, the underperformance of hospitals in Hull, and we're putting in this intensive recovery programme
I'll come to that in a moment.
Deal with it.
The acting chief executive spoke to me last night. She's also in charge of the body that controls North Lincolnshire and Goole Trust. Were you reassured and inspired by what you heard last night?
Well, I watched the programme last night and I watched your interview with Lynn Simpson, and I'd actually had a meeting with her last Friday to discuss the issues that you were talking about with her. And I made it very clear that for my constituents, it is totally unacceptable for us as a hospital trust locally to be 134 out of 134. My constituents deserve better.
Does she have your full confidence?
Well, I think now we've got the announcement from the Secretary of State for Health saying that there is going to be a new leadership team coming in to look at what is going on in the local hospitals. I welcome that.
Does she have your full confidence, or don't you really want to answer that one?
Well, clearly I am not happy that we're 134th out of 134 trusts.
So
that is not acceptable. And she is the chief executive of the trust.
Is she in or not in where Streeting's drain the swamp that he's talked about today?
Well, I think what's got to be recognised is we've had a number of leaders over the last few years. There's been that churn that the Health Secretary referred to.
Well, it's been a mess, hasn't it? It's been a mess, hasn't it?
And it's been in a mess. And I'm really glad now we are getting some action to stabilise the trust, to build morale again, because the other thing that worries me is we've got lots of hard-working doctors, nurses, physiotherapists, all the staff in the hospital doing their best and feeling that morale, has plummeted because of what's happened in recent times.
Does it concern you that the Trust Chief Executive came to Hull Trust from North Cumbria, another trust that's in this bad 5 today that have been announced that need intensive recovery programme? Does that concern you?
Peter, can I tell you, I'm shocked to hear that. I didn't know that, and I am shocked because I think the Chief Executive, the interim Chief Executive, Lynn Simpson, came over from what I've understood to be a trust that was doing well to lead in the interim.
It's in this 5. It's in this 5 today.
And that's shocking, isn't it? I think that's shocking.
You're going to talk to Wes Streeting. What are you going to say to him in a nutshell?
Oh, we've already had a conversation. Emma Hardy, Carl Turner and myself, we've met with him today. We're really pleased this action's being taken. We want to be informed about what happens next, and we will be watching very carefully to see those improvements are made for our constituents.
Dame Diana, good to have you on the programme tonight. Thank you very much indeed for finding the time. Busy day for you. A massive response to the interview last night with the acting Chief Executive of the Trust, which runs the hospitals in Hull and Cottingham. She was giving her reaction. Thank you very much indeed for all the emails, texts and tweets. She was also talking about her salary, of course, which wound a lot of people up, £279,000. This first one, anonymous. The acting chief executive says being bottom of the table is an opportunity to improve. How insensitive to those who have been poorly treated and their families. John says there are far too many managers instead of the people who really deserve their pay packets. There are doctors and nurses who have to work more than 12 hours a day. No wonder it's in a state. And this one's anonymous. Lynn Simpson is paid more than a surgeon or an airline pilot. Who authorised this ridiculous amount of money to pay her? I have to say there were so many emails, not just last night, but through the through the day. And many people who work for the Trust have been in touch. So I thank you for those. And of course, we never use any names, and I have used some of them tonight in that interview, as you heard. We'll follow the story.